In the intense world of medical emergencies,
one patient, 3 times stab wounds.
There's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
You gonna put some oxygen on your pal?
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques in surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate. Oh, no, mate. Oh, no. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
Got an ETA at all to get him out?
It's going to be a minimum of 5.
emergency teams battle to free an injured driver.
I believe his legs are trapped by the pedals and twisted round.
DIY disaster after a pensioner falls off his roof.
You can't fall any further, Henry.
Medics fight to save the life of a cyclist.
Basically, he's got a thoracic brain injury. He is still breathing a bit. That is still him.
And multiple calls reporting a shooting.
There's a gunshot. You need to bring an ambulance now. Oh, my God.
Yeah, but just from a... Just if we get another job on the way back, these hoods both got batteries, both clean to go.
At base, Dr. Polly Haywood and critical care paramedic Sarah Foley are checking in for the night shift.
Right, we've got Rocurone in there, we've got fentanyl there, and we've got ketamine there. So they're drawn up, they're not used.
Dr. Polly spends half her time in hospital as an emergency department consultant
I feel like Tyrone Curry, actually.
and half on the road, responding to life-threatening trauma.
On the fentanyl, you've got the fentanyl vial, and we've got 3. Perfect.
Sarah is a full-time critical care paramedic, working shifts day and night.
There you go. Is it coffee time?
Ambulance service, is the patient breathing?
Westminster Police, can you join us at RTC, please?
Yeah, that's absolutely fine. Is the patient male or female?
Adult male. He's still stuck in the car that he's crashed into a wall. So we're onto fire to get them to cut him out.
Right, okay.
I've got no idea on his injuries because we can't get him to.
Right, he's stuck in the car.
Yep.
It's a major crash. Police, fire and ambulance are already at the scene. Now they've requested specialist trauma backup. Polly and Sarah are immediately dispatched.
Go ahead.
Patient is still trapped in the car with no change in his condition.
Thank you, Grant. We're going to be 3 minutes.
The driver has been trapped for over half an hour and the full extent of his injuries is still unknown.
Trauma desk, this is Mike Delta 98, on scene. Oh, there's quite a lot of debris here, careful.
Evidence of a major impact is strewn down the street.
Where is... Now some railings.
And
there.
we've got the car just there.
The car has spun out of control, demolished a wall before flipping sideways onto a driveway. Firefighters are still working to free the driver.
Got an ETA from the fire to get him out. It's been delayed every time. Just try one thing and it's not working.
Polly and Sarah are briefed by the ambulance crew so they can now lead the critical care.
I believe his legs are trapped by the pedals and twisted round. can't assess his injuries at the bottom because it slipped through the wheels. No, there's a mangled round him.
In the smash, the engine has shunted back, trapping the driver from his abdomen. But it's too dangerous for Polly or Sarah to approach him.
What all I know is that it's lower back pain, so we might have to ked him because I can't do anything until them legs are free.
The Midland Air Ambulance charity covers a region of 6 counties, one of the largest operating areas in the UK.
Element 03 Alpha's road to start recall.
As well as 3 helicopters, the charity also supports the daytime critical care cars in cities and built-up areas, where it's more difficult for an aircraft to operate.
White Delta 98.
98, you're not too far from this. I think about 4 minutes. It's RTC motorcycle v car.
That's lovely. Thanks, Steve. We'll go and have a look.
Critical care paramedic Colin Apps has been working for the service for the last 12 years.
You get to patients a bit quicker on the car in terms of the ones in the urban areas. You can make a real difference getting there quick and intervening in certain ways. It always seems to be busy when it's hot for some reason. I guess people are just more inclined to get out and about and do things and maybe do stuff they wouldn't normally do.
Experience suggests his life-saving skills will be in demand today.
Ambulance service, is the patient breathing?
I don't know. It's just fell off the roof.
Okay, how old is the patient?
81.
Are you with him at the moment?
I'm with him. It's got a smack on his face, on his tummy.
Can you check if he's conscious and awake for me?
Are you awake, love? No, he's not answering.
Okay. Are you breathing in and out normally?
No, it's not.
I've got help coming to you as quick as they can, okay?
An ambulance has been dispatched, but with the possibilities of a fractured skull and internal bleeding, the advanced clinical expertise of critical care paramedic Colin is also urgently needed.
So we're going to an 81-year-old male who's fallen off a roof. I think it was reported that he was unconscious, so that's where we're heading at the minute. And it's very close, actually, so we might actually be on scene first. 6-2, go ahead.
Falling from height is the biggest cause of death for people tackling DIY. Every week, someone is killed falling off a ladder. Fortunately, the address is just minutes from base, and Colin is first on scene.
What's his name?
Henry.
Hello, Henry. Hello. My name's Colin. Can you hear me all right?
Yep.
All right, do you remember falling off the roof? Where have you fallen from, the ladder? Do you know where you are? Just keep your head nice and still for a minute, and we'll see what's going on with you, all right? You've obviously fallen and hit your head quite hard.
His wife, Patsy, was at home and called 999.
He put his foot on the first one and he slipped.
Okay.
A local ambulance crew has arrived to help.
So he is conscious. We'll mobilise him on a scoop, get him up off the floor, and then we can give him an assessment in the back of the ambulance.
As well as a significant head wound, Colin's also concerned Henry has suffered internal injuries. And any medication he's taking could make bleeding significantly worse.
Is he on any blood thinners? No, not blood thinners. He's on blood pressure tablets. I've got his medicine. I'll get everything for you.
What's your wife's name? Patsy. Patsy, he's okay. Okay, he's fully conscious. Just relax. Go and just calm yourself down because we're going to look after him and he'll be fine. No need to rush around and get yourself all worked up. He's going to go to hospital for a checkup and some assessment, but he'll be okay.
Colin must keep Patsy calm. He needs to concentrate on Henry's trauma.
I'm just
wondering, once the roof was off, how are we still lifting that engine block of his legs?
It's 3:30 in the morning, and Dr. Polly and critical care paramedic Sarah are waiting to assess a driver trapped after a serious crash.
Can I just get, you know, Canada in and stuff like that?
They won't let me do anything just yet. They've got a spreader holding the actual car apart at the moment.
Right.
So it's quite dangerous. The front end is really sort of
unstable.
Okay.
Miraculously, despite the high impact, the driver is alive and conscious.
Got an ETA at all to get him out? Sorry.
It's going to be a minimum of 5.
Rescuing the injured in these difficult environments relies on tight teamwork between all the emergency services.
In terms of stability and access to the patient clinically, can we work through this space at all to put a cannula in?
We're going to be, we won't round you if you need to.
Yeah.
Obviously, we're going to cut this now. We're going to get a lot more space and get the roof off.
Yeah.
Polly needs to make the operational commander aware that the driver's condition may suddenly become life-threatening.
So essentially, from a clinical point of view, 40 minutes plus, having that engine block in your legs is a bit like having a tourniquet on. As you release it, you're going to just dump loads of stuff, and that's the point at which he doesn't look so good.
Using hydraulic jaws of life cutters, the firefighters begin taking the car apart.
My lovely, I'm going to give you something for the pain, all right?
An hour after the crash, and with the roof now off, Polly and Sarah can safely treat their patient.
It's paracetamol to start with, but into a vein, so it's stronger than normal. And then we're going to give you some morphine. Have you had morphine before?
Right. Position now, where we can release legs.
Hey, they're going to move the dashboard off your legs now, okay?
We've got a long board ready.
Having given the man pain relief, the team prepare to get him out.
Just going to have a look. Is that all right, mate? No, you're right, you're right. Even if you can't move it much, can you wiggle your toes inside your shoes, okay?
There's no blood around, so I'm happy that we're not bleeding and we can go.
Yeah. Okay,
Okay. It's going well. Nice and steady.
Right, just wait a minute. He's got his legs very, very spread. Think about his pelvis. Sarah, has he got any pelvic pain? His legs are a real kimbo.
Before moving him, Polly wants to be sure he doesn't have a broken pelvis. This could cause a catastrophic hemorrhage.
Sweetheart, is there any pain in your middle by your hips?
No.
No, thank you. Can he come out now?
He can come out now if you're happy enough. If there's no broken legs.
We need him out.
Polly stays alongside the man in case his condition suddenly deteriorates when they move him.
All right, mate, you're doing okay. All right, buddy, I know it's horrid. You're doing all right. You need to open your eyes for me, pal. That's it, good man. I know it's a horrid situation. Sweetheart, have you got any pain across your hips? In your back, in your lower back? Okay, from the middle. We're just trying to get some space to get you out, pal, okay?
Stay sitting forward as much as you can.
There's a hard board in behind you, okay? Yeah, of course we're going to be careful, pal.
You got enough people?
We'll take him to here.
Yeah.
That's it, okay. Well done, you're out, buddy. Okay, and down, and down. All right, matey.
Brilliant. Thank you, guys. That was brilliant.
All right.
It's taken a team of 21 highly trained emergency workers 72 minutes to get the driver out of the car.
Can you raise this leg for us?
Good man.
Yeah, that's fine.
Okay, pelvis.
No, so his pelvis is fine, intact. To be honest, Polly,
Confident the driver has no immediate life-threatening injuries, the team prepare to move him onto the ambulance.
okay, on your call at the head end, okay?
Okay, go.
And down. Great.
Right, Delta 98, thank you. Patient is now being loaded onto the back of the ambulance.
While Sarah updates the trauma desk,
We're just going to do a top-to-toe assessment so that we can work out which hospital this is going to go to, is it?
I know your chest hurts to breathe, okay?
Polly assesses the level of the man's injuries.
Going to bandage your leg, we're going to get you to hospital. All right, mate?
It's clear there is internal trauma. He needs an urgent scan. Holly and Sarah travel with him to the Queen Elizabeth Hospital, Birmingham, where he's handed over to the waiting doctors for emergency care.
What were you doing, Henry? What had you gone up the ladder for?
In Oldbury, critical care paramedic Colin Apps is treating 81-year-old Henry, who has a serious head injury after falling off his roof.
Am I on the roof?
You're on the floor of the mountain, you drive.
You can't fall any further, Henry.
Henry suddenly seems confused, a worrying sign his brain is not working as it should.
Ready, lift.
His brain may be swelling and pushing against his skull, reducing the vital flow of oxygen-rich blood.
So she's put the ladder away, but he was up at this top of the guttering bit, and it sounds like he's just missed his footing on the ladder and fallen. The ladder stayed where it was, and he just fell down to the floor. So quite a fall for his age.
Can I follow with my car off so I know where you've gone?
Assess your knee.
They won't let you in the hospital when we get there.
But how will I know where it is?
So what we'll do is we'll take your details,
right,
just next to him, and someone will call you from the hospital, okay?
Okay, come back.
COVID restrictions mean that Henry's wife Patsy can't go to hospital with him.
We just got him in the back of the ambulance. We're going to do a set of observations. He's obviously elderly, and he's had a decent fall, and he's lost consciousness, so that's a concern. We need to go to hospital with an alert so they can get him assessed and scanned, if possible, quickly if he needs it. It depends on his condition when he gets there. Just have a feel of his chest for me. Just have a feel all round this, because you check. I know you listen. Just have a feel all round. Just check for any fall. Does it hurt anywhere where we press on your chest?
As well as damage to his brain, Colin is concerned the impact of the fall may also have injured Henry's lungs.
Henry, do you have any pain in your tummy?
A blow to the chest can cause fluid to build up, which has life-threatening consequences.
And with your legs, can you move your legs for me? And that one. Can you feel me touching all the way down your legs? Yes.
Any pain in your chest at all?
Listen.
No, that's all right. You just look a bit red in the face.
After masking up, Patsy is allowed onto the ambulance to say goodbye, while Colin updates the trauma desk.
He's impacted the ground with the right side of his head, where he's got a large swelling and laceration above his eye and around his right zygoma. He also might have a broken nose. He's got no neck or back pain. He's got no chest pain. His chest all seems fine on examination. He's not 100% sure exactly what's happened.
Colin is happy Henry is stable enough to be left with the ambulance crew for the 10-minute journey to the nearest trauma centre.
They will assess his whole body. They'll make sure he's not got any injuries they haven't missed. They'll monitor his observations for a good while. They might even keep him in overnight. They might keep him in longer than that. He'll be in A&E initially, and then he'll probably be moved to a ward. So just try not to... As he is at the moment, he seems like he's recovering well. He should make a good recovery, how he seems at the moment, all right?
Thank you very much indeed for all your help.
All right, you take care.
Sorry about this.
No, you don't be sorry. We just hope he's all right, so all the best. His risk factor is his age, and that's why he's going to the trauma unit, where they can give him a rapid assessment to make sure that he's not going to deteriorate. You know, he's 81, he's fallen off a ladder. There's plenty of 20-year-olds that have fallen off ladders, so yeah, he's just got to be careful, but I should think he'll be able to get back to his DIY soon.
Hello, I'm the ambulance service. Is the patient breathing?
Is he breathing? Is he breathing?
Yeah. Is he conscious and awake?
He's bleeding really badly. Hello? Can you have an ambulance quickly? Sorry, I'm a nurse.
The patient's not fully conscious at the moment.
He's breathing, but not fully conscious.
Okay, just explain to me briefly what happened.
He was on a cycle and he's gone over at the junction and a car hit him.
It's the highest priority, so we'll be there as soon as we can.
We have a cyclist instructed
So if you could leave all resources ready, please.
An ambulance has been dispatched, but there's a high chance the cyclist has a significant head injury.
Police room attendant shutting the road off. There's no danger to the crew. Don't require any other resources whatsoever.
Critical care paramedics Aidan Brown and Ryan Ferris have been scrambled.
The initial reports that came through that he's unconscious and having a seizure. Likelihood that he could be a very unwell gentleman with quite a significant head injury.
Reports of the cyclist's condition is so serious, a trauma doctor has also been dispatched.
We've got a run time of 1 minute.
When they arrive, police and paramedics are already on scene.
Hello, good morning, good morning. Hi, I'm Ryan, one of the CCPs.
Hi, but we have a cyclist. He's very irritable now. He's got a nasty wound.
Was there any sort of active seizure activity on your arrival?
Yes, he's fitted.
He's fitted, has he?
I need you to sit still, darling.
All right, sir.
Try and relax for us. We've got you.
The 22-year-old cyclist was on his way to work when he crossed a busy junction and was hit by an oncoming car. The force of the impact threw him into the windscreen and he landed on the road.
Has he got a blown pupil?
No.
No, that's fine.
He wasn't wearing a helmet.
Eyes 1, voice 2, motor 5, so we'll give him a GCS of 8 with a high motor score.
Ryan's initial examination indicates an extremely reduced level of consciousness and a life-threatening brain injury.
Significant right-sided head injury.
Yeah.
But he has got a high motor score. No overpowering injuries, moving all limbs independently. Just very agitated.
Although unconscious, he's fitting and at risk of making the injury worse.
If you're happy, I think what we'll do, we'll sedate him a bit, get him relaxed. Yeah. We'll get him scooped onto the stretcher and we'll potentially just prepare in case he needs an anaesthetic and we'll get him off to sleep.
Aidan quickly prepares ketamine, a drug carried especially by the critical care team to calm him down.
I'll go 30 milligram potentially initially, just to try and get him relaxed.
Okay. Just hold that still for us, mate. Sorry. Let's just get a monitor. We've got a monitor there. Ryan, are you happy with the primary survey?
Sorry, primary survey-wise, yes.
Yeah.
Chest moving equally.
Yeah.
You've seen him move all his limbs.
Yeah.
He's both straight leg raised independently.
Okay, cool.
But just sort of talk to him, all right, because with the ketamine, he's going to have a bit of a strange sort of experience, okay?
The man is so seriously injured, he needs to be put into a coma. But there must also be a trauma doctor present to administer the anaesthetic.
I'll tell you what, let's get a bandage over that cannula as well. That's fine. All right, guys. This gentleman's going to go off to sleep. Okay, so just to make you aware, we're going to just prep, get him on there, and then we're going to give him an anaesthetic and set him off to sleep. All right.
So he's got a traumatic brain injury. Is significantly agitated with a low GCS. So we're just waiting for the HeliMed's medic crew with a doctor on board, and the plan is to take over his breathing, and then he'll be going to a major trauma centre. You stay with the patient, man, make sure we've got a full assessment.
Yeah.
I'll set for an RSI here. Okay?
Yeah, that's fine.
While they wait for the doctor, Ryan and Aidan prep for the complex procedure, one that's normally only carried out in hospital.
So what we'll do, the obs are on. We'll get that on a 3-minute cycle, if you don't mind, please.
The cyclist is still in a very unstable and agitated state.
Have you got the ketamine still?
Yeah.
His blood pressure's fine. He's starting to fight us a bit more. Are you happy if I go for number 20?
Yeah.
Guys, just going to give him a little bit more ketamine, all right, just to relax him.
Thank you. Have you got a rough ETA, please?
Aidan checks the ETA of the doctor.
Just for your information, the patient is packaged on a scoop. We are fully prepped for an RSI, so we're ready on your arrival or received.
Any delay could be fatal.
Thank you. Seven 064-203 over. The patient appears to have a traumatic brain injury, significantly reduced GCS and agitation.
In Dudley, critical care paramedics Aidan and Ryan are fighting to save the life of a cyclist who has a traumatic head injury following an accident.
Okay, everybody happy?
Right, okay. Guys, so I'll take over from here. So we need 2 people going to do an RSI, so it's going to anaesthetise him. Okay, the doctor's just a few minutes away.
A trauma doctor is en route, while the team at the scene prepare to put the critically ill man into a coma. This should reduce swelling and prevent any further brain damage.
If you just pop that out the way, if that's okay, mate. Okay, so hopefully we'll get that reading in a second. And we should have everything pretty much good to go. That's okay, I've got it here, yeah. Yeah, so just wait until we get some end tidal. That suction's all good to go. So observations are okay. We're in a good position in that sense. So as soon as we get some more ketamine, it'll stay a bit flatter and we can prep for the RSI.
Managing the patient's airway during the procedure carries a high risk of COVID transmission, so the critical care team must wear level 3 protective suits.
Okay, I'm going to take over this, okay?
Okay.
Thank you.
Okay.
Okay, are you happy?
Happy, thank you.
I'm going to go and get level 3, Ryan.
Yep.
So everything else should be good to go.
With everything now prepped, a second critical care car arrives with a trauma doctor on board. Aidan quickly briefs him.
It's been quite agitated, so it's had some ketamine. Everything's ready, including the drugs.
Yeah.
So pretty much, as long as you make a quick assessment, whatever.
Yeah,
it's
he's
good
on
to
this
go.
one now.
All right.
Dr. Jake Turner can now oversee the life-saving intervention.
Okay, guys, I'm going to go through a checklist, all right?
Okay.
So oxygen supply,
Oxygen, confirm.
end tidal, BVM, suction,
Working.
on and working, ECG, and ketamine. He has had 100 milligrams already, so now there's 100 left in there.
The doctor now administers the drugs that will temporarily shut down brain function.
Yeah, feels fine to ventilate. He is still breathing a bit. That is still him.
We're happy at the moment. Happy with the air.
Happy, he's still saturating fine.
Okay, I think we have apnea now. On the ventilator.
At the point where the man is paralysed and no longer able to breathe for himself, Ryan must insert a breathing tube down into his lungs.
Okay, right.
Thank you.
Suction is here.
Cheers. Got it. Okay, got a grade 2 view, please. Of the bougie.
Yeah, the bougie.
Thank you.
He has just 5 minutes to start ventilating, otherwise he could die.
Hang on.
And the
I have the
please.
bougie.
Bougie through the cords, that's 23 centimetres at the teeth.
Okay, Ryan, you want to hold left hand, right hand?
Left hand, please.
Happy with this?
Happy, thank you. Thank you for that,
I'll
Aidan.
sort the vents inside, shall I?
The team have successfully anaesthetised their patient and taken over his breathing.
Okay, so end tidal 6, I'm just going to bag a little bit more, bring it down.
Okay, guys, vent is set up inside, ready to go.
He's now ready to be taken to the nearest major trauma centre.
So, happy, he's on about 480 volume. You happy to bring his rate up slightly?
Yeah.
Just for that end tidal.
6-2, thank you. Atmos when you're ready.
Aidan puts in a call to alert them of his arrival.
Thank you. Approximately 20-year-old male, traumatic brain injury, treatment given. He's had TXA. He's had an RSI with rocuronium and ketamine. ETA to the QE is 12 minutes from now.
Ryan and Dr. Jake travel with the man to provide continuous critical care throughout the journey.
GCS initially, eyes 1, voice 2, motor 5, GCS 8, so he had a high motor score.
The paralysing effect of the anaesthetic lasts for less than 30 minutes, so they have to constantly monitor to avoid any conflict between the patient's natural breathing and the ventilator.
We can take that further down on his legs almost. Happy?
Arriving at the Queen Elizabeth Hospital, Birmingham,
Thank you. Can I pass you that?
the critically ill man is taken directly to the emergency doctors.
Initially, with the impact in the head injury, the patient can present a lot worse than the injury actually is because of the initial impact to the brain, the swelling, the bruising. So we won't really know anything until he gets a CT scan. And even then, it may be a few days he remains in an induced coma whilst the brain recovers. And he may have a very positive outcome. Unfortunately, he appeared to be a very unwell gentleman at the scene, so I can only hope that he makes a positive outcome.
ambulance service. Is the patient breathing?
Can I have an ambulance?
Is the patient breathing?
I don't know if the patient's breathing. There's been a gunshot. There's a gunshot. You need to bring an ambulance now.
Oh my God. What's he done?
No, I don't know. It's near like a field.
There's another call coming through. Yeah, I've got it. Black patch car. Yeah. Did she say what had happened? Gunshot.
Every year in England, around 30 people die and over 160 are injured in shootings. With the possibility of a major incident, the police firearms unit has been dispatched. And so too have the critical care team of Dr. Ravi Chauhan and critical care paramedic Richard Apps.
The information is a bit sketchy. It sounds like the call might have come from the firearms unit saying that shots have been fired, but that's the only information they've got. Then there's lots of other calls that are apparently coming in, but we haven't really got any information on patients at the moment.
So that's firearms that have just gone
flying past us.
Emergency teams are racing to the incident, but in dangerous cases like shootings, ambulance crews and the critical care team meet at a rendezvous point until police make the scene safe.
I'm just going to ask him what's occurring.
Operations manager Jason Lowe is also on scene.
Right, so... Have we got patient info at all?
Someone I got when I first got the job has been shot in the head. One crew member from that vehicle can drive this one in, so if they are in arrest, we can go and take it.
Yeah.
All right.
Yeah.
I'll just have a chat with Greg on the 17th.
Yeah.
The medical team need to change into full PPE as resuscitation of the gunshot victim sounds likely.
I will put a Tyvek suit on just in case, but not my respirator, obviously. Because it's a reported shot to the head. So if we do go forward, good potential that it'll be an arrest.
While police search for the gunman and casualties, all Richard and Ravi can do is wait. The critical care team in the West Midlands operate 24/7.
We're on the way to someone who's been stabbed in the neck.
At night, when the air ambulance doesn't fly, a doctor joins the fast response cars.
Look at me.
Tonight, Dr. Matt Rowley is on shift with critical care paramedic Jack Lewis.
Good evening, Grant. We're just going to get some caffeine, mate. Obviously, all checked available and waiting for your call.
Hello, mate. There is literally a job that's come in for medic request, if you are good to go.
Yeah, send it through.
Hello, you're speaking to the ambulance service at the moment.
Somebody's had a car crash.
Okay, how many cars are involved?
He's lost control and it's tree.
Okay.
His car's a rotor.
Can you see whether they are breathing?
They've got him breathing, but he's empty.
Is he responding to anybody?
No.
There's reports of a car into a tree, not very far away from us. Potentially multiple patients, one unconscious, we believe. We've got multiple resources en route.
On average, 5 people die every day on Britain's roads, with countless more seriously injured. Jack and Matt's enhanced life-saving skills are urgently needed.
Quick update from scene. Conscious male patient at the present, bleeding from the abdomen. Got to pacify extreme damage to the car. Update you further shortly.
So, multiple patients, sounds like we've got at least 2, and a male. Sounds like they're still in the vehicle with a bleeding abdomen. I think this gentleman's got potential to be unwell.
On their arrival, police and ambulance are already on scene. One patient, the driver, has just been released from the car.
If you're happy, just continue to the back of the truck and we'll meet you on there. I'll take a look at the car. All right.
He was conscious when the passerby got to him, and they pulled him out of the car, placed him in the recovery position.
The operational commander briefs Matt on the incident.
He's jumped a fair way up that tree, hasn't he?
He really has. So it is a fair way up, and there is quite a bit of passenger space intrusion.
Yeah.
They did pull him from the driver's seat, so his side was quite free.
Right, cool. How are we doing?
With the driver now on the ambulance, Matt begins assessing the extent of his injuries.
Can you give my hand a squeeze for me? Good. Can you stick your tongue out for me? Stick your tongue out.
Roughly, yeah.
Squeeze this hand.
20-year-old Khalil, a restaurant cashier, was driving home from work when he lost control and crashed into the tree.
So unconscious with passerby then, we pulled him out, but then like this with you guys when you got here?
Yeah. If he's got there, eyes were closed.
Yeah.
As soon as he moved at all, flat open eyes, tracking me, and no response at all.
Khalil is agitated, but not responding to any commands.
Sit still for me, alright?
Keep your head down. Good man. Alright.
Whatever you want.
Alright, try to keep your head down. Good man. Alright.
Jack inspects the car to get a better insight into what injuries Khalil may have sustained.
So significant passenger space intrusion. Driver space looks all right.
The windscreen has a clear imprint where Khalil's head smashed into it.
So he's clearly been unrestrained.
Jack updates the trauma desk.
Airbags have been deployed and it's clear that the seatbelt was not being worn. It's still fastened, so he's been sat on it by the looks of things.
All the indications are Khalil has sustained a life-threatening head trauma.
I haven't got you a full GCS breakdown, but safe to say he's not a GCS 15. It will probably either be the QE. We're just getting him on the back of the vehicle and sorted out. We'll come back to you with some obs and a plan shortly, not behaving normally. We're going to sedate him slightly, but it might be that that escalates to a full anaesthetic. But I'll come back to you with full details in a little bit. Receive. Just relax, mate. Just lie back.
Yeah.
Lie back.
For me, all right? Keep your head down for me. Good man.
$96.60. You want to just snapshot that for us?
We've got BM5.
BM5, cool. Have you got a bandage here?
In Tipton, Dr. Matt and critical care paramedic Jack are treating 20-year-old driver Khalil. His head smashed into the windscreen after he crashed his car into a tree.
You can see from the vehicle that all the impacts have been taken on the passenger side, which is probably the only reason he's still alive. Although he's not been wearing his seatbelt, so he's clearly been thrown around in the vehicle. We can't see anything obvious in terms of fractures or huge wounds, but his behaviour is certainly not normal, potentially consistent with a head injury, like a closed head injury. So our first step is we're going to just give him a little bit of sedation so that we can assess him properly and calm him slightly. And then if needs be, it might be that becomes a full anaesthetic, but he's certainly gone through a significant mechanism of injury there.
So we're going to give him a bit of ketamine, just see if we can get him chilled out a bit.
Yeah. Okay.
If we can't get adequate control of some ketamine, then we'll put him off to sleep.
Sit still for me. Good man.
You smell any alcohol at the top end? No.
While giving the ketamine sedative, Matt and Jack discuss his coma scale assessment.
So GCS-wise, we are probably an E3, V1, motor, and then 5 probably, too localised.
Khalil's score is on the border between moderate and severe brain injury.
Is that a fair impact?
Oh, it's massive.
Enough to shake his head around. Can you give my hand a squeeze for me? Just squeeze my hand. Good. So yeah, he obeys commands. So if you're happy, I think we just go. Airway-wise, he's all right, isn't he? He's oxygenating, he's ventilating well. As you said, whether he's a bit shook up because he's had his brain rolled around his head, I think if you're in agreement, I don't think we should RSI him at the moment and just...
His airway's very patent, it's self-maintained.
Just a little bit of ketamine if he gets unmanageable again, and 20 seems to have worked the trick.
Yep, sounds good to me.
After assessing him, Matt and Jack don't think a full anaesthetic is needed.
Up to the QE.
The ketamine has relaxed Khalil, enough to ensure he's safe to travel to hospital.
60.
Yeah, go ahead.
Jack updates the trauma desk, who will alert the Queen Elizabeth Hospital, Birmingham.
We can't find any obvious kind of musculoskeletal injuries. There's no abdominal guarding, chest seems clear, and nothing to the head. We've had a small amount of ketamine sedation, but doesn't require anything further from us, so we're going to be escorting to the QE with an approximate ETA of probably about 20 minutes. So.
Yes, that is all received. I'll give them a shout for you.
Khalil is still in a life-threatening condition, so both Jack and Matt stay on the ambulance to closely monitor him, ready to intervene on the journey if necessary.
You give my hand a squeeze for me? Good. All right, well done.
He will open his eyes across.
Yeah. So we're going to take him into resus at Queen Elizabeth Hospital. He'll get assessed by their trauma team. They'll reassess his airway, breathing, circulation, and then he'll probably need to go for a CT scan of his head and any other bits of his body that the team feel appropriate when they have a look at him.
At the Queen Elizabeth, the critical care team hand Khalil over to the trauma doctors for the next stage of his emergency care.
It's a massive impact, massive mechanism. Even we don't see that type of mechanism that regularly. And although we get a lot of RTCs, generally if people are wearing their seatbelts, they generally do okay. But as soon as people stop wearing their seatbelts, those are the ones that tend to come across our door a little bit, because they generally have more significant trauma, more significant injuries that require our support. Anyone involved in that type of incident is lucky to be alive. You know, if the car had hit the tree on the other side, then, you know, he probably would, you know, that would have probably been a fatality.
Ravi and Richard are in Smethwick, responding to multiple calls reporting a shooting. Police have been searching the area for the last 20 minutes.
There is evidence of a party, but there's no sign of any shooting, no sign of any patients, no sign of any disturbance.
It could be a malicious call, but the emergency team need to be sure no one's in need of their help.
Try and get us cleared.
They've gone in and done a sweep round, there's nothing there. So I took on the phone and say they need to go and do the sweep round.
It does sound like it's going to turn out to be a hoax. Or, if not a hoax, a misunderstanding or misheard gunshots. So we'll, at the moment, I think we're going to stand by with the first crew, but we may get stood down ourselves shortly.
Another search of the area uncovers nothing. It's a frustrating but not uncommon false alarm.
So the firearms unit, they've probably got a few of them roaming around, and then obviously, yeah, we've got 2 crews, 2 officers and ourselves here, so yeah, it's quite a lot of resource for these kind of things. Fortunately, lots of them don't turn out to be anything. The majority don't, so, which is a good thing.
In the 25 minutes Ravi and Richard have been on scene, West Midlands Ambulance Service have received 70 genuine emergency calls.
Your ambulance code red is back next Wednesday at the later time of 10. If you or someone you know has been affected by any of the issues raised in tonight's programme, please go to channel5.com/helplines for information and support. And next Wednesday at 8, the start of brand new Car Pound Cops. Give me my car back. Tempers are frayed as those clamps go on. Next tonight, Casualty 24/7, every second counts.